me now is Dr Bharat Pankhani, an expert in infectious disease. Very good morning to you. 411 days testing positive. Have you ever heard anything like this before?
It's not impossible. It's unusual, but not impossible. And by the way, this is clear. This is good biology in action. So this person was immune suppressed. And as a result of being immune suppressed, they had this persistence of infection. And I have seen many of these incidents in, for example, TB. When they are immune suppressed, the infection carries on without doing much damage to the lungs, but it can still be there. So it is possible biologically.
And there's no medicine to cure COVID per se, is there? So what kind of treatment did he receive and how much difference did that make?
So he was given the whole armamentum, antivirals, antibodies, and what has worked is that he had the original old version of the virus against which the antibodies made in the laboratory worked, and eventually he was cured. So the important point here is if we imagine that the spikes on the virus are the nuts and the antibodies are the spanners, then if the nuts change shape, the spanners will not fit and work. So the new variants that we have, Omicron, etc., they are not attacked properly by the antibodies that we have made, and they are therefore not working anymore. So we would have to go back to the laboratory and make a version of antibodies that work against the circulating Omicron, for example.
And are treatments like this still considered experimental, or are we getting a real idea now of how people with persistent or serious cases can be treated?
No, we're learning every day, and whilst we started off as pioneers, we know a lot more about how to tackle this, and we're getting better and better at it. So remember, we've got the steroids, then we've got the antiviral drugs, and then we've got the antibodies. So we are getting much, much better compared to 2 years ago.
And what about understanding why some people get the disease more seriously and some get it for longer? Do we have a real understanding of what it is that are the factors in determining that?
No, that's still work in progress, and it is very important to understand that immunology, because some people get that infection, recover, end of story, and some people get that infection, the infection goes, but the immune system carries on overreacting, and then you get this incidence of what we call brain fog, tiredness, and generally being unwell. And then we have to end up suppressing that immune system. So there's a lot to learn, but we're learning, but we haven't cracked it all together.
Very briefly, former Health Secretary during the time of COVID, Matt Hancock, is going on I'm a Celebrity. Quick thought on what you make of that?
I think it's very disappointing because I personally was involved in all this, and I feel, nursing homes, people died. There were these VIP contracts, the failure of PPE, so much. So I feel very disappointed that Matt Hancock seems to have put all those failings behind him and he's off on a new career.
OK, we must leave it there. Dr Bharat Pankhani, very interesting to talk to you this morning. We really appreciate it. Thank you.